Welcome back to Winging It Buffalo Style. We're turning our gears to physical therapy because as we find out, it's not just about rehabilitation, but also about preventing future injuries. We're joined today with Dr. Sean Reister and Dr. Matt Sondricker of Reister Physical Therapy Services. Now, I have to say, when I was in college swimming, physical therapy just sort of became part of our lives, preventing injuries and, sort of sustaining these injuries that we already have. So, I know the benefit for it, but for people out there that have never been to a physical therapist, what benefits are we looking at?
Well, the big thing is, I think the common image of the physical therapist when we see like in movies or on Sports Center, so it's that person who's like post-surgical or post-medical event. But actually, now, especially in New York State, that's changed a bit. Actually, our office, we'll see people sometimes right off the street with their primary complaint, whether it's joint pain or back pain or something like that. And in New York State, it's kind of nice now because in the last 5 years it changed. We're actually a direct access state now. It used to be you needed a script to see a physical therapist for something. Now, actually, most insurances will cover it. You'll be able to come in and see us like right off the street for your problem.
Now, previously on Winging It, we talked about children who are constantly playing the same sport, and we start to talk about overuse injuries. Is physical therapy a good way to kind of figure out what they need to do to make sure that they don't overuse or hurt body parts that they're going to be using the rest of their life?
Well, I'll tell you, I know like the Little League Governing Association has some really good guidelines out there for ages of kids, baseball pitchers specifically, and how that works. For us, and when people come in, whether it's for a problem or if they were concerned about a potential future problem, as physical therapists, we're kind of like movement analysts. So when someone comes into the clinic, our eval is actually about an hour long. So we're taking a look at not just soft tissue, how that moves, how your joints move, but strength, weaknesses, lack of range of motion. And when it comes from a treatment standpoint, that's how we kind of develop that. So as far as finding the problem that we might have, then we're able to take a look at that and kind of put it into a regimen. And like you said, as far as preventing an injury, sometimes with kids like a core weakness or lack of rotation on a hip, that could be a type of a thing that if they wouldn't know about it, but that it creates that wear and tear down the line that might lead to injury.
Now, there are so many places to go. We could be talking about really anything from dentists to primary health care physicians. So many people out there to go and get help from. So how do we know with physical therapy to find the place that's going to be best for the needs that we're having right now?
Well, Matt, with any aspect of healthcare, the most important thing, in my opinion, and Sean will probably tell you the same thing, is direct one-on-one time with your patients. And because of reimbursement issues in the area, sometimes that can be tough, and therapists might have to see multiple patients at one time. But really, the key to having positive outcomes and achieving the best goals for our patients is really having direct one-on-one time with your patient. Whether it's 30 minutes or sometimes up to an hour of one-on-one time with direct physical therapist is very important.
Now, when we're talking about people, athletes or people that are experiencing some pain, a lot of people out there just want to tough it out. They want to kind of wait a couple days, wait a couple months, see if it's going to happen. I know I have a lot of friends that do this. Why shouldn't people do this, and why should people go and get that evaluation just to see what's going on?
Well, sometimes if you had like early onset of pain, it could be the indication of like a potential problem, and to take care of it earlier, I mean, we'll look at people gosh, joint replacements, right? Hip, knee. I mean, a lot of times I always used to look at that as, hey, it's a great medical procedure, things that can get done, but if we can get on top of that early, and maybe not just treat it with just a pain medication or, staying away from the problems that's causing it mechanically, if we can fix that, we could kind of get away from some of those bigger types of procedures to fix things.
And now, do you have a website people can go in for more information? I know there's a lot we could talk about.
Yeah, we have our Facebook page we use most of the time, but we also have reisterpt.com. It's our website. We've been working on putting that together, but we've been having so much fun with the Facebook site. It's just, we follow stuff. We've been following I've had my own injury that we've been rehabbing on there. He's been working on it, so
all right, well,
we've been having fun with it.
Thank you guys so much for coming in. And of course, we'll post all of those links onto our page at wingingit.tv. Right now, though, we're going to